Hi everyone. Today I'm going to talk to you about overweight and obese status of African American women in South Carolina. A little bit about myself. My name is Mallory Doolin. I am a registered dietitian licensed in Massachusetts, and I am also a graduate student at the University of New England. So, a little bit about today, why we're here. I'm going to give you a little bit of an overview of what we're going to be talking about to guide you through this presentation. So, first, we're going to start off with a background and talking about really understanding obesity and overweight status in African American women in South Carolina. Then we're going to speak about obesity determinants of African American women in South Carolina. Then I'm going to bring it all together. I'm going to talk to you about some potential interventions that you can do as the Department of Health to really make some positive changes. And then finally, just some concluding thoughts and time for questions. So let's get started. So some background information. So 79% of African American in South Carolina meet criteria for overweight or obesity status. 57 of African Americans in South Carolina do not get enough exercise or physical activity. And physical inactivity is more common in African American women versus African American men. Additionally, African American women are at high risk for other chronic diseases, including heart disease and stroke. They also have higher incidences of hypertension, diabetes, and high cholesterol. So really, all together, the bigger picture, we're talking about an overweight and obese population that has a high incidence of many chronic diseases. So we want to take some positive steps to influence their health. So what determines the obesity or overweight status of this population? Well, as you can see here, this is a little bit of an outline that I've made for the socioeconomic model. It's what it uses to talk about the different determinants. And I'm going to break it down for you in the next couple of slides. But this is the overview that you can see on the handout that I've given you. So to start, demographics, gender, and ethnicity all play a major role in this population. So the highest rates of overweight and obesity occur among populations that have high poverty rates and little education. Individuals living among lower socioeconomic status tend to have poor nutritional status and decreased physical activity. So as you can see, demographics play a major role among those that are living in poverty, have little education, less in physical activity, poor nutrition intake, and then also gender, being a female, and ethnicity, being African American, also can determine obesity status. Additionally, inadequate fruit and vegetable intake can play a major role in overweight and obesity status. In South Carolina, 42.5% of adults consume less than one serving of fruit per day, and 26.8% of adults consume less than one vegetable per day. So overall, the consumption is very low. And also it was found that there's inadequate physical activity. In South Carolina, less than 50% of the adults living there are meeting the recommended 150 minutes of moderate intensity physical activity per week. There's also an increase of sedentary behavior due to lack of access to sidewalks, parks, and recreation facilities. So the environment plays a major role here. Additionally, the geographic location plays a major role. Rural communities have higher incidences of overweight and obesity compared to the urban counterparts. And lastly, South Carolina has many food deserts. Overall, for South Carolina, for every one fresh food outlet, whether it be a farmer's market, a supermarket that sells fresh produce, any kind of store like that, there are 6 convenience food outlets. So little stores that aren't going to offer a wide selection, might be fast food, might be quick prepared, and very little fresh fruits and vegetables. Work environments, places of worship, and healthcare all contribute to overweight and obesity status among African American women. So these are all places within the community that can influence sedentary behaviors or encourage physical activity. So those places are determinants of obesity. And then lastly, on a system level, government, the public health system, and the food industry / technology all can influence weight status. So there's a lot of things that can influence overweight and obesity among this population. So some interventions that can be used. Through my research, I found that successful interventions use community locations to promote healthy habits and nutrition education. So some suggestions that could be successful in for this population would be using beauty salons, places of faith, and health clinics. So a little bit more about that. Beauty salons. So this research study found that cosmetologists at local salons who served as health promoters to improve fruit and vegetable intake, physical activity, and water consumption successfully and positively influenced fruit and vegetable consumption for the African American women in the treatment group. So a beauty salon was found in the rural areas to be a positive place where they could have a successful nutrition intervention in a non-traditional place. Places of faith are also a great place to influence African American women. African American in this research study, African American parishioners at different churches were used as health promoters in nutrition intervention efforts to prevent overweight, obesity, and diabetes. The research that they found, the results were excellent. The faith-based group, so the group that was using the parishioners to influence their health-related behavior change, had a significant decrease in adjusted weight loss compared to the group that was not based with the faith. And the faith-based group also had lower levels of fasting blood glucose. Lastly, another place where successful intervention can be made is within health clinics. So this one looked at pregnant African American women and that were overweight and successful weight gain recommendations or weight loss recommendations following a pregnancy. So the women who participated in this study were less likely to exceed weight gain recommendations, and there were favorable results in physical activity and reduced caloric intake promotion following having their child. So tying this all together, really to think about it, some successful interventions have been made with this population in South Carolina and neighboring states using community resources to promote health. So really what I like to think about is let's use these community resources and promote health behaviors through different channels and people instead of some of our traditional ways. Let's use those cosmetologists and parishioners to meet people out in the community where they are to really provide that lasting change and do it in a different way. And also, we want to promote health in traditional ways too. So using health clinics and places where people go for their routine health activity, and then using those credible sources are such as doctors, dietitians, nurses that have that background in nutrition. They can really help promote some healthy habits as well. And then finally, a lot of this comes down to the environment, and we want to increase walkability and improving active living initiatives throughout the community. So making sure that we're fixing those sidewalks and increasing that physical activity, because not only do we want to be eating well, we want to be moving well also. So I want to just conclude all of this by saying, there's a lot of different ways that we can promote health in South Carolina and reduce the overweight and obesity status among African American women. Let's use all hands on deck and some non-traditional and traditional ways to make these positive changes. Does anyone have any questions? I would invite you to answer them now. And I will switch to my reference slide so you can take a peek at some of the ones that I used today. All right, thanks. Have a great day.